Y'all want to see what's in my bag? Nothing. It's empty. I took everything out, so now we have to put it all back in before it's time to go to the hospital. So let's get started. So I want to go over what's going to be in my bag first, but I'm also going to tell you what I'm packing for hubby and for our little baby boy. So let's get started with my bag, and let's put everything back in there before I end up forgetting something, because I am currently 38 weeks pregnant. So I have 2 more weeks left until my due date, and I'm really excited. So it could happen at any moment. So I just have everything thrown in the crib right now, so I'm just going to be picking stuff up and putting it in my bag as I tell you about it. But first, let me start with the bag. So this is my hospital bag. Well, this is what I'm going to use as my hospital bag. It's just a pink duffel bag. Pretty simple. And I got it from TJ Maxx, and it was 30 bucks. So, and it came with this little bag also that you can use for your makeup or toiletries or whatever. It has a front pocket, and then on the inside it has a place for your laptop to go right in this hole, which is perfect. And then it has a large zipper on this side, like that. So all of my stuff should fit in here, as well as hubby stuff and the baby stuff. So I'm going to try to make it all fit in this one bag so we can just grab it and go. So this is my second time doing this. I've already had one baby, a little girl. She just turned 1, so this is our little baby boy this time, and they're going to be really close in age. So I kind of know what to expect. I kind of know what to bring and what to leave at home, because I'm going to the same hospital as well. So for clothes, I'm not packing much at all, and you want your clothes, well, me personally, some women want their clothes to be tighter, but me, I want very loose fitting clothes, because your belly is still going to be big after you give birth. It doesn't just go back flat automatically. It's going to be big still, and it's still going to look like you're pregnant. So you want some loose fitting clothes, in my opinion. You may want the tight stuff, but that doesn't work for me. So let me show you what I packed. I just have this loose fitting t-shirt, and I packed some shorts because I'm not sure if I'm going to be hot or cold, but I packed some shorts, just some loungewear shorts like this. But I also packed some sweatpants just in case it's a little more chilly that day, because here in Alabama you never know what you're going to get with the weather. So that's one outfit. And then for my coming home outfit, I wanted to look a little cute, you know, because last year it was during COVID, so no one got to see our baby girl until we actually got home. So everyone was here waiting on us. So I want to look a little cute just in case that's the situation again this year, which it might be. I haven't talked to the doctor yet about the visitor policy, so I'm not sure if they're still not allowing visitors or they're allowing visitors. So I'll have to find out at my next appointment. But just in case, I want to look cute coming home. So, but I also want to be comfortable. So I picked up this outfit. I have these dark blue sweatpants, and they are high rise, so they're going to go right over my belly. And they're just really cute. They're just really cute blue. And I got blue because we're having a baby boy. So yeah, I just did that. Alright. And for the shirt, I got this one. And I actually got this at Burke's. I got this shirt and the blue sweatpants from Burke's. And it's just this cute little butterfly shirt. It's going to look really cute with those blue pants. And it's really loose and it's really soft, which is really important. Okay, so let me tell you why I prefer loose clothing as opposed to the tight leggings that some women want to wear after they give birth. It's because, well, like I said, I've been through this one time, so I kind of know what to expect. You're going to be bleeding a lot, and you're going to have a lot going on down there. Whether you tear or not, you're going to be bleeding, and there's going to be a lot going on. So you want to be really comfortable, but also you have to think about the diaper that you're going to be having to wear to catch everything. And just think, when you go to the bathroom, every time you go to the bathroom after labor and delivery, you're going to want to change your diaper. You're going to want to feel a little fresh down there. And if you have on these tight leggings, which took you forever to struggle to pull them up on top of this diaper, just imagine taking those leggings off, because you have to slide your diaper off and put a new diaper on. So you have to take them completely off every time you go to the bathroom. So imagine doing that with some tight leggings as compared to these loose sweatpants. You could just hit these babies on the ground, take them off, put your new diaper on, and then put these back on. Or some shorts. Some shorts would work better too if you feel comfortable in shorts. But that's just why I prefer loose clothing, and I'm not wearing no leggings after I give birth to my baby. So that's that. So I feel like with this time, I know exactly what to pack and what to leave at home, because it is my second time going into labor and delivery at this hospital, and my daughter's only a year old, so I did this just last year. So I kind of have a fresh mindset of what to pack and what to leave at home. Now, the next thing I'm going to show you is the diapers. So these are the diapers that I'm talking about. I have found that these work the best. They have some support to where they stay up. Now the hospital will give you some mesh panties, and you'll have to put a pad in that and then all your stuff, but you can put your pad and stuff in these too. They're just a little bit more comfortable than the mesh panties. Some people find it hard that the mesh panties don't want to stay up, so they'll use these instead. And I really like these. Now I'm not taking all of these to the hospital. I'm just going to open it up and take a few with me and just see what I use. And I got two sizes because I can't remember last time what size I had got, but I got a large and a medium. So I'm just going to take some of both with me just so that I'll have them and I'll feel secure if I don't like the mesh panties that they give me. So I have these diapers. So while we're talking about what's going on down there and what you're going to need, I want to go ahead and talk about some stuff that I'm not going to bring to the hospital, and that's because the hospital will give this to me. So I'm going to leave it at home as my extras. I have some big pads here, but that's for a little bit later. For beginning, I'm just starting with the diapers, and then the pads come later once you stop bleeding as much. So in your diaper, you're going to need some stuff. You're going to have a lot going on. They gave me last time this hemorrhoid foam, and it really helped out. So I have this. And then they gave me these pads. And I think you can get something, they gave me these pads. And I think you can get something similar called Tux pads. I'm not sure, but these are the ones that the hospital gave me. And they work really well. You just put a couple of these in your diaper, and it helps to cool the area down there. And it just feels really good. It helps with the swelling and with the stitches. These pads are really good. So if you don't know if your hospital provides this for you, I'll definitely get some of these just in case, so that you can have them if the hospital doesn't give them to you, because they're really nice to have. And then the other thing that the hospital gave me last time was this Dermoplast spray. And this stuff is awesome. It really helps. Like, every time you go to change that diaper, spray some of this on your fresh diaper. Well, not on your diaper, but spray it down there. And it really helps with the pain, and it provides like a cooling sensation. This is really good. So this is the stuff that I'm not taking because I know the hospital will give it to me again. But if you're unsure You might want to buy like at least one of each of these just so you can have it just in case, because these things really help. Really, really help. One more thing that the hospital is going to give me is a Perry bottle, but it's the ones that are straight up and down. I threw the other one away from last time, but I found that that works fine for me. It got the water where it needed to go, and it helped me to stay clean down there. But I also have this one from Freedom Mom. I know a lot of women talk about this one, but the straight up and down Perry bottle to squirt the water down there to clean yourself, because you don't want to wipe, especially if you have stitches. You need that bottle. It worked fine for me. But they have this one from Freedom Mom, and it just looks like this. And so when you squirt, this one has an angle right here, so it helps you to get the water more up there. You know what I mean. I mean, this one's fine, but I found that the straight up and down, like the ones from the hospital, do not have this curve right here. It's just a squirt bottle that stops about right here, and you just squirt like that. I found that those work fine, but if you want to, you can get a bottle like this. Okay, so now that we're done talking about that area down there, let's get back on to the clothes. I'm gonna bring a comfy bra. This is just a little sports bra that I found at Walmart. This is the one I'm gonna bring. I don't plan on breastfeeding this time around, so I wanted something a little compressive so that it's hard to explain, but you'll understand once your boobs get the milk in it. I wanted a little compressive. And while I'm talking about this bra, I'm also going to be taking these breast pads. You can use any breast pads, but these are the ones that I had around the house. So I'm going to take some of these to put in my bra just for the milk, so that I don't have to keep changing my bra. I can just change these breast pads right here. You just need something to catch the milk leakage that you have. So this is what I'm using for that. And then I'm also just going to take a pair of socks, just in case my feet get cold, and a pair of these granny panty things. I probably won't be wearing these because, like I said, I'm going to have on that diaper, and I really don't find it necessary to put these over the diaper, because the diaper, the Always diaper that I showed you, it stays up fine. But I'm going to take them just in case, just so that I'll have that peace of mind that I have them. So that's that. And I think that's all for clothes for me. So I'm also going to bring a laundry bag just to put our dirty clothes in, to keep them separated from the clean clothes if we don't wear them all. So that's just what this is. Just a simple laundry bag. So this is going to be my toiletry bag. I have some body wash, some shampoo, conditioner, Q-tips, toothpaste, and our toothbrushes in here. And mine and my husband's toiletries are all going to go in this bag right here. Make sure you bring some hair ties or a scrunchie, so you can throw that hair up if you get hot. And then this bag right here, just small bag, I'm just going to put my makeup in it whenever we do leave the house, but it's not in here yet. I'm just going to throw it in here when it's time to go. I probably won't put on any makeup at all, but I'll have it there just in case I feel like it and we want to take some pictures before we go home. So this is for makeup, and I'll just throw that in there, and this bag will be ready to go. Okay, so I think that covers just about everything from my bag except like electronic stuff. So of course I'm going to bring my phone charger, and this one is 10 feet, so it'll come in handy. So I have my phone charger. You don't want to forget your phone charger. It's how you keep your family updated about your little baby that was just born, and you can start clicking those pictures. So you want to make sure you have a phone charger. I'm going to bring my camera just in case. I don't know, it might come out, it might stay in the bag the whole time, but it will be there with me. So I have my camera, the extra batteries, and an extra SD card. I'm going to take my laptop, and the last thing that's going to go in my bag is going to be snacks. we can't really have snacks just laying around the house because right now I'm craving sweet things, so they will get ate. So the snacks will go in very last minute right before we go out the door. But you really want to make sure you take some snacks, girl, because you may not be able to eat anything right when you go in before labor, but after, those snacks really help you cope. So take you some snacks. So I'm going to pack me some snacks and hubby some snacks. So let's move on to hubby's bag, which actually his stuff is just going to go in my bag too. But I'll tell you a little bit of what I'm bringing for him. And I say what I'm bringing for him because if I left it up to him, he wouldn't pack a bag at all. And we would be forgetting things that he actually needed once we got there. I'll probably throw in his tablet last minute just so he'll have some entertainment while I'm recovering. And also I'm going to throw in his phone charger last minute. I'm going to pack him just some basketball shorts just so he can lounge around in those, and then one change of clothes just in case he wants to take a shower. And then this is his toiletry bag. He has all of his stuff in here already, so we don't have to worry about that. We'll just throw this in there. And I'm going to make sure to put in his mask and my mask. And then another important thing you want to remember is to bring your insurance cards. So that stuff isn't going in my hospital bag. It will actually be in my purse, and it'll have my insurance cards and my money from the vending machine or takeout food, and a lot of other unnecessary stuff is in that purse, but I'll have my purse there just in case as well. Okay, so now for what I'm bringing for baby boy. So I have all of his stuff right here. I really want to take some mittens just so he doesn't claw his face up. The hospital will give me a pair, but I just want to have some extras just in case. So I have a pack of mittens to take. And then I'm also going to take some little socks for his feet. Okay, and for his outfits, I couldn't really decide because these were really cute. And I wanted to pack a couple of different sizes because I have no idea how big he's going to come out. He may be, I doubt he's going to be a preemie. My babies are big ones, thanks to their daddy. But he's either going to fit newborn or 0 to 3 months. So I packed some outfits for both of those. And let me just show you. So I have this one, and it's a 0 to 3 months. And it's just this cute little onesie. And then the next one that I have is actually in a size newborn. And it's this one, and it's just so stinking cute. And then I also wanted to pack some basic ones. I don't know, just because I couldn't decide. These are in the size newborn as well, and they're really, really tiny. But I have a blue one and a gray one. Just striped onesies. And then I have this little pair of pants to go with them, just in case. It's a little chilly. That's it for clothes for him. I'm also going to pack his blanket. So this is his blanket that has his name on it. And I'm going to pack this little toy just so we can put it beside him, maybe for some pictures or something like that. It's just this really cute little koala bear. And then while we're on the topic of photos, I'm also going to pack his little name board right here. And I already have it kind of set up for what I want it to say. And I have the extra letters and numbers right here. So it's just going to look like this. And I want to take his pictures with this board where I can put, let's see. So I can put what time he was born, how much he weighed, how many ounces, and how many inches. So I wanted to make sure to take this so that we could get some cute photos with him. And I believe that's everything that I'm packing. My little girl is going to stay here at the house with her grandfather and Nana. So all her stuff is here, so I don't have to worry about packing a bag for her. I'm pretty sure I'm forgetting something, but maybe I'll remember before time to head to the hospital. But let me just show you my bump. 38 weeks pregnant today. 2 more weeks. Okay, I think that's everything for my hospital bag. And this is what it looks like once I get everything in it. It's pretty big, but it's only one bag that we have to worry about grabbing, besides my purse. But here we go. So now we're just ready to walk out the door whenever the baby decides to come, or whenever my induction date comes around. We'll have our bag ready. Besides the last minute stuff that we have to throw in here. But other than that, we're ready to walk out the door. So I will try to link everything that I can down in the description box below in case you want to check it out. Or just go over the list of everything that I talked about that I'm bringing to the hospital. Please be sure to hit that subscribe button and like the video if you enjoyed watching.